Okay, so I've been stressing for the last few days about what could possibly be going on. And what the conclusion I came to is I'm probably suffering from rheumatoid arthritis, which is an autoimmune disease. So before I get into all that, I just want you to try to just look at my hands here and just see how swollen they look. This one actually, so once I decided it could be either multiple sclerosis or rheumatoid arthritis, I started doing like diagnostic checks to see if I could determine or figure out which one it was more likely to be. Based on what I found, I'm thinking it's rheumatoid arthritis. This hand I already started rubbing on, but if you can look at the both hands, this hand looks bad now, but this hand was horrible. And this hand was horrible, and now this hand looks better, except for right here because I didn't massage any of the knots out right here. So this part you can still see is real swollen. I didn't do anything to the thumb on this hand yet, but when I started to look at the joints of my fingers, they were on top of each other, and this is still a knot. I haven't rubbed out at all yet. That's why this finger's still huge. And the joints had lapsed over each other in the middle here. And one joint had a knot on it in a position that pushed the other joint down. So it had came down. And what I want to do is, because this hand's pretty much rubbed out, let's see if there's any big knots here that I think would make this look a little less swollen. There's a big knot right here that I'm going to rub out. But if this is not noticeable, the other finger has some pretty noticeable ones still. This hand was really noticeable before ooh, this is huge. It is not as small as I thought it was. So they're really hard, and I honestly shouldn't be doing this to myself, because that's the reason I'm probably having flare-ups and growing knots, pressure points anyway, in the first place or whatever. So I don't know if that oh, there's a huge one under my thumb. Oh my God, that thing is humongous. You can probably see that on, it looks like a knuckle, but it's a knot on top of my knuckle. So I'm gonna rub it out. The reason I'm able to do this, you can see that one's really bad too, is because I found those knots and I had rubbed those out. And once I rubbed those out, I got a lot more relief, and I could just do so much more work. And the further I open up the joints, the more of a smaller space I can get into and find smaller knots that are in tight spaces, and the joint just opens back up like magic. So this thing has gotten so small I can pinch it between two fingers now. Here, pinching it on both sides, just trying to hit it hard as I can. But I don't know if you can notice how much swelling down. I haven't gotten it all the way out. There's another big one right beneath it. Whew. Boy. They just don't stop. I'm going to pause the video, and then I'll come back when I got it all the way out. Okay, well, I couldn't get it all the way out, but you can see it's a little bit less puffier, but I see another knot that's going to be easier for you to see me get out. I thought I saw right here, and that's basically at the base of my thumb. So, and it hurts. It's not, I mean, they hurt. Because you gotta rub really hard to get them off. But once they come off, it's like, I don't know if you could hear that. Maybe you can't because somebody got a phone. So, it's almost actually gone. Let's see if I can get it down some more. It's another one. I mean, once you get one, you see it's another one right on top you got to get before you can finish getting that one. So basically, this is 2 back to back, and you maybe can hear it popping. That popping sound is the stuff like coming off little chip by chip as I rub it up against the actual bone. I mean, it's hard and you don't have enough strength. So I'm soliciting some help, and I'm going to rub a couple of these knots off, even this one maybe. Get this one rubbed off, and then I'll be back in a minute to let you see. So hold tight. So real quick, I just want you to take a look at that thumb knuckle. And if you can see where I rubbed off and where I didn't. And I'm going to point for you real quick, and then I'm going to rub off the other part and let you look at it again. But that thing looks horrendous, right? But that's where I didn't rub, and that's why you can really tell it's really swollen now, because now this part I got off, not all the way, because this thing is hard as a rock, but I got off a significant amount that you can see the difference between this and this now, and this makes this look a little bit more protruding. And I didn't work on these ones again yet, but I'm going to work on those ones right now, and then this anterior portion of the thumb, and then you can see that little knot that I couldn't get out because it needs a lot of squeeze pressure. And then there's a couple of big knots over here keeping this pad fat, but I'm gonna try to get this all out before the end of the video so you can really see the difference. All right, hold tight. Well, we've been rubbing for hours and didn't know it was so many knots that could be in this little spot. But I don't know if you can see that the swelling over here is down my thumb. You can see that there's still a pretty big knot here. There's a knot there. And I had the knots that were here. Hold it. The knots that were here. And here, they went down a little bit, and got a little bit more off of that finger. So you can see that this knot's still big, so it's still got a lot of work to do there. And if you just look at both hands together, you'll see. So what I'm going to do is keep rubbing, and then I'll do an update video, let you guys know how it's going. So as of right now, I'm thinking it's rheumatoid arthritis. Once I cleared up a lot of these knots and the joints that were overlapping each other, the inflammation in my hands subsided, and the inflammation in my arms subsided, and the inflammation in my body has kind of subsided since. So I just wanted to make a quick update on what is going on. Thanks. Keep me in your prayers. Keep watching.